Hi everyone, I am Dr. Andi. It is time for today's Facebook Live. As I give all of you the opportunity to log on and join me today, I will give you a brief introduction into who I am, a little bit about my background. So I am a naturopathic physician. I have been practicing in Toronto, Canada for about 12 years now. I've been an educational specialist for Prove It since the very beginning, at one of their very first Prove It events, sharing and educating on ketones. My role with Prove It is as an educational specialist. I like to share my experience with ketones, how I use it in clinical practice, research. I personally have been keto for over 10 years now. That was my own personal health journey that led me to keto. It's something I sort of stumbled across and then sort of started to introduce and integrate into my practice with all of my patients. And then of course with exogenous ketones, that's made a really significant difference in my practice. Especially for those patients who aren't able to engage in a ketogenic diet, or who do sort of modified versions, but they still get the benefit of ketones. In my practice, I have sort of a broad range of practice. I focus a lot on health and hormones for men and women, regenerative medicine, anti-aging, and then a big focus as well on chronic illness. So Lyme disease, chronic fatigue, fibromyalgia, chronic pain, Alzheimer's, reversing and preventing chronic cognitive decline. And at the foundation of many of our protocols are really that low-carb keto lifestyle, or exogenous ketones as well, which has made a really significant difference and impact in my practice. So I am going to start getting right to your questions today. I know I always miss a ton of them. Hopefully I can answer all of them. I will try, and as I said, I will try and go through afterwards and get to them if I miss any during the live today. So first question, I used to drink ketones and then stopped. Would it be best for me to kickstart again with a 24-hour fast or a reboot? That's actually a really great question. So I like that. And I will touch a little bit on fasting as well, because fasting and intermittent fasting is one of my favorite tools to use in practice. I think it's also a really easy thing to implement in practice. So do you need to sort of kickstart with a reboot or a 24-hour fast? No, you don't. So if you haven't been taking ketones for a while and you want to restart, you can absolutely just start. You don't have to be fasting or anything like that. You don't have to be following a ketogenic diet to start either. That is one of the benefits of exogenous ketones, is that it allows you to experience the benefit of being in nutritional ketosis, even if you haven't engaged in the lifestyle practices to put you into nutritional ketosis. So no, you don't have to do a 24-hour fast or reboot to sort of kickstart that for you. Of course, I always encourage my patients to engage in the fasting. The way I like my patients to do the fasting and then extended fasting is a 16-hour fast, at least 5 times a week from dinner until your first meal the next day, a 24-hour fast once a week, and then an extended fast like the Reboot once a month. So for somebody who's just starting, you don't have to do the fast to get back into it. You can absolutely just start taking your ketones again, although I do encourage my patients to introduce the intermittent fasting. Are ketones good to get rid of stubborn menopausal tummy fat? That's a great question. So ketones have quite a few benefits that can be applied sort of in that menopausal phase. We know that when women move into menopause, they become insulin resistant. We have high cortisol levels. High cortisol, high insulin both of those are fat or are storage hormones, so they tell the body to store fat. And so there is a component of beta hydroxybutyrate or ketones that can encourage fat burning or fat loss. So yes, there could be some benefit there. When we touch on the fat or weight loss question, though, I always like to remind people that ketones are not a weight loss supplement. We see fat loss as a secondary benefit to what the ketones are doing in our system. But yes, there is some really great benefit during menopause as well. What is intermittent fasting? Great question. I talk a lot about fasting on my live, so thank you for reminding me that it's always important to go back and introduce the topic for some people who are new or who aren't familiar with fasting. So intermittent fasting is essentially just changing when and how we eat. So instead of eating multiple times throughout a day, we're eating within a certain window of time in our day. We're engaging in an intermittent fast 16 hours at a minimum to turn on a process called autophagy. Autophagy is a process of how we clear out dead, damaged cells in our system. It's a metabolic reset. It has an impact on our inflammatory and our immune systems. And so engaging in intermittent fasting, there's also a lot of research looking at its role in our genes, epigenetics, regenerative medicine, anti-aging. And so essentially it's just allowing your body a certain amount of time without consuming specifically glucose, but anything that's going to spike insulin, so that our body can turn on that innate process for sort of clearing house and regeneration as well. So intermittent fasting, you can do it in a few different ways, but the way that I like to introduce it, there are multiple methods of fasting. The way I like to introduce it to my patients is that 16-hour fast nightly. So you're sleeping through most of the fast. So you're sleeping through most of the fast, and so you're doing it overnight. You're essentially just skipping breakfast. And then in that fasting window in the morning, you can have water, coffee, tea, as long as there is no sugar in your beverages. So that's generally how I have my patients engage in a fast. Mitoplex or Himalayan pink salt, I actually wouldn't replace one over the other. They're two different things. So I actually often have my patients take both. Sometimes I will have patients put a little bit of Himalayan salt. I'll have them salt their food for sure. Depending on my patients, if they have POTS or adrenal fatigue or something like that, I might actually have them drink some Himalayan salt in water. But I will still have my patients take their electrolytes. So I wouldn't replace one with the other. I usually have my patients do both. And so if you were to pick one, I would probably pick an electrolyte blend and just sort of pour that in and drink them with your ketones. But I will usually have my patients take both. So I don't usually have one that replaces the other. So I have a pack of ketones that feels clumpy inside, but the expiration is good. Can I still use these? Yes, absolutely, you can still use them. It's a powder. Sometimes that powder will sort of clump together in that way. So absolutely just sort of loosen it up a little bit. And I often use sort of one of those coffee hand mixers to mix my ketones anyway. They will dissolve and break up in water. So yes, you can absolutely still use those, even if it's a little bit clumpy. And again, because it's still within that expiry, you probably don't have an issue. Of course, if you're concerned, obviously contact support, but they should be just fine. You have a friend who wants to know why she feels dizzy or nauseous. So it could be if there's any dizziness or nausea that is occurring. First thing with the nausea or the gut, the first thing is I would reduce the serving or the dose. Sometimes it can be a little bit disruptive to the gut when we first start taking ketones. So I would just reduce to a half or a quarter of a serving to start, and then slowly increase as you become more adjusted to having ketones in your system. I do always remind people anyone can be sensitive to absolutely anything. So if you have an allergy or sensitivity to something in the product, then there's not much we can do to mitigate the side effects you might experience from that. If you do feel dizzy, my suggestion would be to mix it with Mitoplex. I know we were just talking about electrolytes, just to make sure that she's not experiencing a little bit of dehydration. So that's something that I would encourage you to do, is start taking with the Mitoplex, because ketones and ketogenic diet can act as a bit of a diuretic, so we can often lose some of our minerals. So it could be that they're feeling a bit dehydrated. So I would add the Mitoplex and go from there, and that should help with the dizziness. So can we chat about thyroid and Graves' disease? So I'm thinking the question is this safe to take if you have Graves' disease or hypothyroidism? So essentially just the effect on thyroid in general. So there shouldn't be a negative impact on thyroid function from taking exogenous ketones. The concern is often with the ketogenic diet, how it negatively impacts or how that negatively impacts our thyroid. And I did a presentation at this at one of the last events actually. And so the concern is often that people have come to understand that if they don't eat carbs, it negatively impacts their thyroid function, or that carbohydrates, or that the thyroid needs carbohydrates to function. So that's not actually the case. What happens is when we consume carbohydrates, our body has to produce more thyroid hormone in order to metabolize the carbohydrate. So it's not that the thyroid needs carbs to function, it's that carbs need thyroid hormone to function. So it's actually the reverse. And the only time I see a negative impact on hormones are when people are not getting enough of those healthy fats in their diet. It's important to remember a ketogenic diet is not zero carb, it's just low carb. So you're still getting carbohydrates in your diet, but it's very, very important to make sure that you're getting enough fats. The fats are probably the most important piece. We need fats to make hormones. So I only see hormone disruption when someone follows a ketogenic diet and they're not getting enough fat in their diet. So why take exogenous ketones if not on a keto diet? Great question, Jen. That's actually one of the primary reasons to take exogenous ketones. If you're not following a ketogenic diet, then you will never have beta-hydroxybutyrate in your system, which means you can't experience the benefit of ketones if you're not following a ketogenic diet. And so that's one of the primary reasons we want to take exogenous ketones, so that our body can be put into nutritional ketosis even when we're not following a ketogenic diet. So we still get those benefits despite not having made the dietary change that allow us to move into nutritional ketosis. So a day with a lot of carbs and sugar, what can you do with what can ketones do? Okay, so my first question to this is, ketones obviously cannot erase any sort of poor food choices we may have made in a day. So if you've had a day with a ton of carbs and a ton of sugar, taking exogenous ketones, it can't erase those calories. It can't erase those elevated blood sugar levels. It can't do that. That's obviously not what exogenous ketones or beta-hydroxybutyrate can do for you. However, if you have had a day of high carb or high sugar, the beta-hydroxybutyrate can still provide some support in terms of blood sugar levels. There's some research looking at its role in insulin resistance and insulin as well, so there is still some benefit, but obviously, of course, it is not going to erase any of the food choices that we may have made in that day. But again, you will still experience the benefits of having beta-hydroxybutyrate in your system. What about doing a 16-hour intermittent fast? Yes, absolutely. That's my favorite sort of daily fast to have my patients do. That's something I have them do quite regularly, at least 5 times a week. So absolutely a 16-hour fast. And then if you can extend it, I have them do 24 hours once a week, and then a reboot once a month if able. If people are new to fasting, for some people, even 16 hours is too much. Not only is the idea of a 16-hour fast too much for them, but they just can't because the body is so carb adapted. 16 hours, they're getting hypoglycemic. I have patients who are getting headaches and dizzy. So it's a slower transition for them. So I have some patients I start at 10 or 12 hours, and then after they become adjusted to that, we move up to 14 hours, and then we get up to 16 hours. So I've had some patients, it's taken us a couple months to get up there, and that's fine. You have to find what works. You have to find what works for you and what your body is able to tolerate. Again, nothing is sort of cookie cutter, and there's no one size fits all for everyone. So if something's not working for you, even if that's what everyone else is doing, make a few adjustments so that you find what does work for you. I use ketones now. My legs and ankles are swelling. Again, this could be a little bit of this could be a bit due to dehydration. So I would add some Mitoplex to your ketones, but also speak to your doctor because obviously ankle swelling, we want to make sure that that's actually due to ketones. One of the things I always ask my patients when they say, I took this and it caused this side effect, my question is always, are we sure it's what you were taking that did that? You need to go speak to your doctor and investigate to make sure something else isn't going on that's causing some of that ankle and leg swelling. But if it is due to the ketones, then it means you're a little bit dehydrated. And so you need to add some electrolytes in when you take them. Is moving in and out of ketosis harmful to the body? No, you can absolutely move in and out of ketosis. Our body knows how to make use of the fuel that it needs. It knows how to use ketones and knows how to use carbohydrates. There's no problem with moving in and out of ketosis. And that's actually usually what I put my patients on who are keto long-term. I call it cyclic keto, or it's called cyclic keto. I call it sustainable keto. No one is going to be on a low-carb diet for the rest of their life. No one's avoiding carbs for the rest of their life. And so once I get my patients into ketosis, we then introduce sustainable keto, which is cycling in and out of ketosis. So that's actually what I encourage my patients to do. There's absolutely no harm in doing that, and it actually makes keto more sustainable as well for patients. And so the same goes for even if you're not keto and you're taking exogenous ketones, you're obviously going in and out of ketosis, and so there's nothing wrong with that. Is Splenda okay to use for my sweetener? No Splenda. We want sugar alcohols, monk fruit, stevia, but no Splenda. Splenda is toxic, it's neurotoxic, toxic to the gut and to the brain. I did a whole presentation on artificial sweeteners, so I could talk on that for a whole hour, but I won't. But no Splenda. That's not the desired sweetener. I mean, again, at the end of the day, if it's every now and then, it's not going to hurt you, but no, that shouldn't be what you're using as your primary sweetener. So you've been taking ketones for 2 years and you feel you've gotten the keto flu. So I would just make sure that something else isn't going on. It's very uncommon for somebody to experience a side effect from something that they've been taking for so long. So I would actually just check and make sure that there's nothing else going on. It's really uncommon, again, for someone to say, I've been taking this for a year and now all of a sudden it causes this side effect. That's not a common outcome when it comes to, supplementation and things like that. So I would just speak to your healthcare provider and just make sure there's nothing else going on there. Is it beneficial to intermittent fast every day? Do you intermittent fast every day? Personally, I wouldn't say every day, I do most days. The most important thing is when it comes to intermittent fasting is it's not about starving yourself. If you really feel like you need to eat, you can eat. And then I usually have my patients, I feel that they want to have brunch with their family on the weekend, or so they want to have brunch with their family or something like that, and that's fine. So I usually encourage patients to do it maybe 5 nights a week. But if there's a morning that I wake up and I feel like I want breakfast, I will have breakfast. It's not about depriving yourself or forcing yourself to do something that doesn't feel right for your body in that moment. So if I wake up one morning, I'm not usually hungry in the morning. I'm not a big breakfast person. I like my coffee. But if I wake up one morning and I feel like I need to eat, then I'll eat. But otherwise, I'm intermittent fasting. It's also something that I really encourage people to use when they've hit a weight loss plateau. I saw a question sort of scroll by a second ago of somebody feeling like they're not getting their fat loss or weight loss goals just yet. Intermittent fasting is a really great thing to incorporate to help with that. It's a really great thing to reset, especially if you've hit a plateau. And if you haven't seen the weight loss goals that you were expecting, this is where you have to start looking into the other things that can impede weight loss in general. So things like hormones, thyroid imbalance, menopause, andropause, high cortisol, high insulin, inflammation, microbiome dysfunction, all of those things can impede fat loss. So again, I've said it once, I've said it a million times that weight loss is not about calories in, calories out. It's not eat less, move more. It's hormonal. So if you're struggling to lose weight and you're doing all the things that should be helping to get you there, you need to take a look at all the underlying hormonal factors. It's not about willpower either. If it were that simple, we wouldn't have so many people struggling. There is something called willpower fatigue. So there's a reason that people are really challenged to engage in some of those changes in diet. So there's so much more underlying weight loss. So first step, if you started to take ketones, that's fantastic. You've sort of started to, you're starting to make those changes, but now you need to look at some of the other underlying factors that obviously can't be addressed with beta hydroxybutyrate. So if you have low testosterone or, you're in menopause, things like that, you have to work with a healthcare provider, work with your healthcare provider and see what else is underlying. And also important to know that fat loss or weight loss happens at different times for everyone. There are things that are happening internally that we can't necessarily see. I always tell couples when they come in to lose weight together, please don't compare your journeys to each other. Your weight loss journey will be so different from somebody else's. Someone might lose 20 pounds in a month. Someone might lose 20 pounds in 8 months. It's very different just depending on all of the other underlying metabolic circumstances. So please don't be discouraged. If you're already starting to make some of those changes, then know that you're sort of on the right track and just get some of those other things checked out. Can you please speak in regards to dirty or clean keto? I love that question. And some of the differences on that. For sure. The dirty keto, as they call it, is sort of the keto where it's like bacon and cream all day long. Essentially it's just all the unhealthy foods that are just sort of really, really high fat. That's not how I want my patients to follow a ketogenic diet. I want healthy fats. I do want them eating lots of great protein. It's not bacon and cream all day long. It's not whipped cream all day long. I'm still having them, most of my patients, I'm having them actually follow keto dairy free. Again, depending on what we're addressing, not everybody, but it's still healthy plant-based fats, lots of good animal proteins, vegetables are still included in there. So there is a healthy way to follow keto. I think dirty keto helps a lot of people transition who are struggling to make the diet changes that they need, knowing that they can eat bacon and whipped cream and fried foods and things like that all the time. I think that there are certain people that serves to help them make that transition, but that's never how I want someone to eat long term. I still want them eating some of those healthier foods. So from a long-term standpoint, if it helps somebody transition, that's fine, but long-term, that's not really what I'm wanting them to do. So the good fats like avocados and olive oil, things like that, like the healthy sort of plant-based oils. Again, it's not just, there's some people who are eating bacon every day, the fried foods every day, they're eating whipped cream every day. That's not what we want. I'm okay with people eating cheese, but again, it's not cheese on everything all day long. You can still overdo the fats on a ketogenic diet, and that's where I'll often see people struggle to lose some weight, where they're having too much fat. I will often add people to include, goat cheeses when possible, not only just cow's milk, because it can be a bit inflammatory. So there are ways that you can tweak the diet to make it a little bit healthier. But again, there is a place for the dirty keto when it helps people transition and start to make some of those dietary changes and cutting out some of those unhealthy carbs. So again, there's a place for everything. Depends where you're coming from, depends what your goals are. If someone's eating McDonald's all day long, I'm not asking them to eat chicken and broccoli for dinner. So there's a place for everything. Will drinking ketones break your fast? I definitely let my patients have ketones during their fasting window. A lot of the research on fasting is showing that some of the benefits, or suggesting some of the benefits, may actually be because of the production of ketone bodies. So drinking ketones in the fast, I'm perfectly fine with that. SSRIs and ketones. So if you're on any medication, you have to speak to your healthcare provider. I do have a lot of patients on SSRIs. So what I'm asking my patients to do is just take them separately. Again, speak to your healthcare provider, make sure there are no specific interactions for you, make sure there's no reason that that they shouldn't be taking it. You might have to be careful anything with 5-HTP in it. So sleep formula, things like that, you may have to, that's probably something you shouldn't combine. But if you are taking a medication, I would say just take them separately, leave a little bit of time between them, and of course, speak to your healthcare provider. Explosive diarrhea after NAT, and fasting. So if those are both two new things for you, then you may want to separate it, maybe end your fast with your ketones if you find that doing them together. I know some people, when they're fasting, they can't consume a lot. So for example, some people can't have coffee on an empty stomach. Just not something that your body tolerates well. So if that's the case, they can end the fast with their ketones as opposed to having ketones in their fasting window. I just saw a comment that I said no to Splenda. I did say no to Splenda. I don't know what the question was before, but I absolutely said no to Splenda. It was monk fruit, stevia, sugar alcohols, but Splenda was definitely a no. Xylitol is fine. Monk fruit is fine. But no, the Splenda was a no. And if you actually go to the Splenda website, they'll actually explain how they make it. And there are actually chlorine molecules in there. It's, again, neurotoxic. It actually has a feedback loop where it can actually trigger food cravings and weight gain. So that's not what you're looking for, obviously, when you're trying to find a sugar alternative. So I would not, yes, and someone's talking about some other studies showing not to buy that sweetener, and absolutely. So there's a lot of research on the toxicity of Splenda, again, how it can contribute to food cravings, to weight gain, neurotoxicity, gut disruption, throws off your microbiome. So I would absolutely take that out. Lots of questions on heartburn. And so that's interesting. Somebody was asking if it could cause heartburn. Someone is mentioning, Sean, you're saying it actually helped with your heartburn as well. So a lot of gut questions today. So if you are experiencing any kind of gut disruption or diarrhea, anything like that, you might just want to reduce your serving. reduce to maybe half a sachet or a quarter of a sachet. And then once your gut has adjusted, you can slowly work your way up. Or if you're someone who can't take it on an empty stomach, then add a little bit of food with it, take it with a meal if that's something that helps your body tolerate it a little bit more. It's hard for you to eat more than one day. So no, that's bad. So someone is saying that they have one meal a day. Is that a bad thing? No, it's not bad to eat one meal a day. When people do that, so I'm a big proponent of listening to your body. So we don't want to I don't want anyone to force feed themselves. So if you don't have an appetite, you're not hungry, you don't have to eat. But if you're only eating one meal a day, it is important to make sure you're getting all the nutrients that you need in that one meal. So it would be really important to make sure that's a really good sort of calorically dense meal, well balanced. Just make sure you're getting all the stuff you need in that meal of the day. But the idea that we have to eat, 5 meals a day, eating every 2 to 3 hours, really that we've shown that sort of theory has been, disproved many times. We do not need to eat every 2 to 3 hours a day. We absolutely can engage in some of that intermittent fasting, more extended fasting. And the research actually shows that so a lot of people are concerned that if you engage in extended fasting like a Reboot, that you're just going to binge eat afterwards because you've been deprived for so long. And the research doesn't actually show that. What it actually finds is when someone ends a more extended fast, their calories are actually more controlled for the few days following. So people don't actually seem to be binge eating after they engage in some of those more extended fasts. And so we're not seeing that. We're also not seeing, when someone engages in those longer ones, we're not seeing loss of muscle mass. You can maintain your muscle. Your body's not going straight to breaking down protein during those times. So again, there is a lot of misinformation about the fasting and the idea and the concept that we have to eat at certain intervals in a day is not the case anymore. And so I do always encourage my patients to eat when they're hungry. I encourage intermittent fasting. Most of my patients are eating twice a day. Maybe they're having a snack in there. So at the most 2 meals and then a snack is what I'm having my patients do. A question regarding a metabolic disorder. I don't know which one you're referring to, so I don't know that I can quite answer that question. I'm sorry. So you're asking about a metabolic disorder and a keto diet. So I'm not quite sure what the metabolic disorder is or sort of what that question might be. So feel free to post again. But sorry, I'm not able to answer that one. Just a bit more information. I used to be able to work out and fast, and now I get hungry after a workout. Is that good? Yes, that's totally normal to be hungry after a workout. Most people are. Some people will find that they are not hungry after their workout. There's a bit of an interval. You don't have to eat immediately right after your workout, but if you're hungry after your workout, that's normal. So do your fasted workout and just have a good meal prepared for you after your workout. That's not a problem at all. I don't know if you're exercising in your fasted window, so your question is if you eat after your workout, you end up having to shorten your fast. If that's the case, that's the case. Again, with the fasting, it's never about forcing yourself to starve. I don't want my patients to feel, and I did have a new patient had started fasting, and she said that by the time she hit the 10 or 12 hour mark, she felt horrible. She couldn't focus, couldn't work. She was starving. And so that was somebody that I said, well, 10 hours is your mark then. We're not wanting you to get to this point of feeling so horrendous and depriving yourself just because you're supposed to fast for that period of time. So it's just a slower workup to that extended fast. And so if you have a workout and you feel you need to eat afterwards, then please do that. It's not about starving or depriving yourself in any way. So that is it for our time today. That flew by today, as it always does. Lots of great questions today, a lot of gut questions and some fasting questions as well. As always, I will try and go back and answer some of your questions if I can. But enjoy the rest of your week, everybody, and stay healthy.